name's Alyssa. I'm a nursing student at NUR235. Is it okay with you if I do an ear, nose, and throat assessment on you today?
Yes.
Alright. Have you had any problems with your ear, nose, or throat?
I've had tubes put in my ears.
Alrighty. So first I'm just going to look at your ear and look at your pinna. They look symmetrical on both sides. The position of your ear is right above your eye, which is great. I'm going to check and palpate for some nodules. Alright, I don't feel any nodules, and I see you have 2 lesions on your right ear and 2 lesions on your left ear, which is perfectly normal. Next, I'm going to check your external canal. I don't see any redness, swelling, any drainage there. I don't see any redness, swelling, or any drainage there either. Next, I'm going to take a look at your internal ear. So I'm just going to pull out and back on your ear. All right. Check this ear too. Again, I'm just pulling back and up. All right. So your tympanic membrane is a nice, did it tickle? Sorry. Your tympanic membrane is a nice pearly gray color. It's translucent. It separates your external and internal ear. I also saw your light reflex in your right ear was at 5 o'clock, and your light reflex in your left ear was at 7 o'clock. Your umbo was resting right above it, which is normal. And I saw your short process, which is just a little hump in your ear. And then I also saw your long process. I didn't see any abnormalities or anything like that, so everything looked normal. So next I'm just gonna move on to your function test. So if you can just close one ear for me. All right, I'm gonna stand behind you and whisper 3 words to you if you could repeat them to me.
Dog, cat, mouse.
Great job. So next I'm just gonna check for lateralization. So can you hear evenly on both sides?
Yes.
All right. Next, I'm going to check your Acbc relationship. Let me know when you stop hearing it.
Stop.
And let me know when you stop hearing it.
Stop.
All right. So your Acbc relationship is a 2 to 1, which is great. Didn't see any abnormalities. Your hearing looks great on both sides. So next, I'm just going to take a look at your nose. It looks symmetric, it looks midline. I'm just going to palpate it and see if it is firm. All right, it feels firm and stable. So next, if you can just hold down one side of your nose and breathe in for me. All right, next side. All right, your patency is even and normal. So next, if you could just hold down on one side, I'm going to get you to sniff this. Other side. And what smell is that?
Vanilla.
All right, great job. So next, I'm going to take a look at your lips real quick. So your lips look symmetrical. They look even. I don't see any lesions or abnormalities, and they look nice and moist, and not chapped or dry or anything like that. So that's good. Next, I'm going to take a look at the mucosa in your mouth. So if you could just open up for me. All right, your mucosa is a nice red color, pink color, no abnormalities with that. I also saw your Stensen duct, which is right above your molar in the back, which is completely normal. Next, I'm going to take a look at your gums. So if you could just open up for me again. All right, your gums are a nice pink color. They rest nicely on the teeth. And next, I'm going to check for sensitivity. So I'm just going to take my tongue blade and rub it against your gums and make sure there's no bleeding or redness or anything. And I don't see any bleeding or redness there, so that's good as well. Next, I'm going to take a look at your teeth. So if you could just smile and open up for me. All right, have you had your wisdom teeth taken out? All 4 of them?
Yes.
Great. I'm counting 28 teeth, which is great. I didn't see any cavities. Your teeth are a nice whitish yellow color, which is normal. And so next I'm just going to check your bite. So if you can open up again, I'm going to move this to the side if you want to bite down. All right, I see a little bit of an overbite, but that's completely normal. Next I'm going to check your tongue. So if you can stick out your tongue for me. All right, your texture is smooth. I can see some bumps in the back, which is completely normal again. And I see that white covering on your tongue, which is also completely normal. If you could stick out your tongue and move it up to the sky, down to the floor, left and right. Great job. I didn't see any tremors. You have great bilateral movement and you can touch your bottom lip with your tongue. So next, I'm just going to check your palate. So if you can open up again. All right. So your hard palate is a nice whitish pink color and your soft palate is a nice pinkish red color. I didn't see any lesions or abnormalities there. Next, I'm going to check your throat. So if you can open up again, say ah for me. All right, your uvula looks great. It is midline and it has great bilateral phonation. I'm going to check one more time. I'm going to look at your tonsils and your pharynx and everything. Say all for me. All right, your tonsils look oval. They look rough. They are equal on both sides. They're about a +1. They're a nice pinkish red color. Didn't see any abnormalities or anything bad there. And then your pharynx is a nice red color. Didn't see any abnormalities there. Is there anything else I can help you with today? All right, well that completes my assessment. Thank you so much.
Thank you.